Hello, I am sharing this week's update. Today is Friday. 5 days ago on Monday, I started a new peptide cycle with a product called ThyroPep. And yes, that is holy. I don't even have words for how much it's already helped me. My thyroid, I'm hypothyroid. If you look at my labs though, I keep being told that it's normal. Um, it's not. Taking that peptide on Monday, I took it and I felt like a sharpened number 2 pencil. Fog cleared up, colors got more vivid, vision sharpened. I lost some of that blurry vision I thought I was having from blood sugar. Some of that's gone. It's definitely a step in the right direction. I'm so insanely grateful for that product. I did a kickoff video for the peptide cycle, the mitochondria and drainage jumpstart program, the new probiotic I'm taking for weight loss and energy and whatnot, and then also a gut health optimization course. I'm working on kind of editing that and making my videos look, I don't know, a bit nicer. So I'll get that up soon, and I'll continue to film like as I kind of go through my cycle. I'll continue to do updates. So I'm super excited. I don't know when. I know that ThyroPep contains a thyroid glandular and then some bioregulators. I'm not sure when the bioregulators start working, but I'll just keep tracking all of my symptoms and reporting on here. And I'm just really excited about it because it's like a piece to my puzzle. It just fit right in. Felt like I should have been taking that for years. And I literally felt benefits from it the first day, which is like amazing. So not overwhelmed anymore. Um, Actually, my sense of overwhelm went away when I took the ThyroPep. Yeah, I'm happier too. I just seem more resilient. And once I get my testosterone replaced, I really think I'm going to be in a really good place I haven't been in ever. So I'm really looking forward to that. Right now, I am with the mitochondria and drainage jumpstart program. I'm following instructions, and I'm really working on trying to get my blood sugar controlled. Like, I'm still doing the intermittent fasting, but instead of pushing to the 16-hour mark, I just kind of see how I feel. And, I'll eat around like 10 or so. And that's still a good chunk of time for fasting because from 6 p.m. to 10 a.m., that's a good amount of time. I guess I was doing 18 hours before. Sorry. I'm still doing 16, but whatever. It's working and it's helping. And I'm making sure that I am exercising. I'm trying to go as slow as possible. I am really not good at that though. But Dr. Khan gave me a different target heart rate to shoot for. And today will be day 4 of exercising to that heart rate. So I'm feeling pretty good. Definitely. And I also started yesterday. I did my first block therapy, and that is going to be huge too. Like, I basically just use this towel and put it on my stomach, laid on it, and then breathe, just deep breathing. And I can literally feel it in my atlas. Like, it's pain, but it's good pain. And I've had fascia therapy before with a practitioner. It was like, I can't remember how long it was after my car accident, but it was a very painful and long process, but it's what gave me my mobility back. And I'm really excited about continuing block therapy. I'm like sitting here about to actually do my second day of it. After I was listening to a summit and I heard the woman talk that is doing the block therapy, and I could not get in here fast enough to try it. So I think that's going to be a really, really good move to fix my posture. And yeah, the pain with it though is going to be interesting. So I did hear about this new, I guess it would be called a supplement that's supposed to help with pain. It's called the Pain Fix Protocol, and just everything they were talking about rebuilding degenerating discs, or just everything that was going on with my spine. Um, they I feel like that supplement could really help me. As man, my spine is screwed up. I have herniated disc, a couple bulge discs, military neck, unstable pelvis with a herniated disc in my low back, and Lyme disease on top of that. It's not a good time. So I'm hoping to find some relief through the block therapy, and perhaps if I can get on the pain fix protocol. And of course, I know I need a chiropractor. Um, Calling around to new doctors right now is a bit challenging. A couple doctors ago, I was blacklisted here in the city because the doctor didn't want me telling people what she did to me. So, and on that note, I want to talk a little bit about medical gaslighting and medical trauma. I feel like, I read this. I just dropped a word. Damn it. I read this study on Reddit about medical gaslighting for chronic Lyme disease patients. I swear it was like someone followed me around for like the last 20 years and decided to write about my life and published it. Like it was that solid, and it was so validating to read it, and to know that, the things that I went through about being misdiagnosed since 2006, being shuffled around the medical system because nobody knew what to do with me. Or, you get misdiagnosed with something like, my head injuries and the Lyme disease and neuro-Lyme got misdiagnosed as bipolar 2. And I think back to all those years that I spent in just hell, just absolute hell. And you'd go to your doctor and you tell him what's going on. And once you get the bipolar 2 diagnosis, no one listens to you after that. They think it's part of the mental illness, and they just keep throwing more and more pharmaceuticals at you until you pretty much shut up. Which is what happened to me. And it was very difficult and traumatic. I went through, once I got the bipolar 2 diagnosis, I went through therapy for bipolar 2, I guess. And I was basically taught systematically over the years not to listen to myself, that the emotions and the signs, there are signals that my brain and body was sending me were wrong, and that I shouldn't act on anything that I feel. And at the time, the emotional dysregulation was leading to a lot of scary behavior, because of the brain damage. I couldn't think through risk and reward, or how to properly go about anything, really. I just kind of was running around, just free range, just doing stuff without any safety net or any kind of executive functioning. And that's when the gaslighting started, was the misdiagnosis. It's not even intentional malicious gaslighting. It's literally what these doctors think. They literally believe that, and they're telling you as the professional that this is what's wrong and here's how you have to handle it, and everything you're feeling is a part of, whatever this diagnosis is. And it makes you, when you live that way for as long as I did, which is, I'm sitting here and it's almost 20 years after the fact of my accident. So I'm 41 now. I lost pretty much my entire adult life. I lost to misdiagnosis and or being underdiagnosed, or you know, being told that it's in my head, or that the anxiety was, I could control it through deep breathing. And it's tough, like going through something like that, and then on top of that, all of the crazy medical trauma. I don't know why I have so many wild stories about doctors and medical stuff, but I do, and I hate it. I don't want these to be a part of my life, but they are, unfortunately. And I can't tell you how hard it is to have something as severe as traumatic brain injury, and not just one, two, and then also damage to my brainstem, go undiagnosed for as long as it's been undiagnosed. And then I don't even know I have traumatic brain injury. I find out like 2017 through a podcast. And it wasn't even me that found the podcast. It was my fiance. He had heard it, and he thought to himself, "My God, Rachel does the same stuff." Sent it to me, and that's when I knew. I knew I needed hormone replacement therapy, and that's what got me on the right track. But and I've been going at it, full throttle ever since then. But the thing that I didn't expect is the psychological impact of actually healing and getting my brain back. I have parts of my brain back now that I haven't had access to in 18 years. And, there is no one for me to go to say, how do I handle this? Or what have your other patients done to deal with XYZ? I haven't had anyone to talk to about any of this. So that's part of why I started this YouTube channel, because damn it, I need to tell someone because it's been such a wild, crazy ride. But getting your brain back is a miracle. But there's also a psychological toll to realizing that the majority of your adult life was lived by a total stranger, and you had no idea it was going on. It's a crazy experience. It's like some kind of dystopian novel or something. It's crazy. It really is. So anyway, and then on top of that, to wake up from brain damage to a body that is brutally sick to the point that death is much closer to me than most other people. It's scary and it's frustrating. It feels like the medical care, it never ends. Like I now have to go and get I need to get polycystic ovarian syndrome ruled out. So I hope I don't have that, but I don't know, maybe I do. It's frustrating, but at the end of the day, I'm here. I have my brain back, and I have this opportunity ahead of me to tell my story and to possibly help other people who, going through something similar, can't find a diagnosis, a proper diagnosis or proper care. And I just hope that my near 20-year saga can benefit someone other than myself, because this entire journey has felt bigger than myself. Yeah. All right. Well, I think that's it. Oh, yeah. And Mima's fine. She bounced back from that so fast. So I'm just glad I don't have to make any difficult decisions. The grief aspect of that is just, oh. So, all right. Take care.